This patient came to see me 2 years ago, over 2 years ago, for endodontic treatment of tooth number 3. As you can see, decay into the pulp. So she had all the signs and symptoms of irreversible pulpitis. Look at tooth number 2. Look at the root canal on tooth number 2. The dentist just found looks like one canal. And this root canal, according to the patient, was done a few years ago. Patient had no symptoms whatsoever. And no periapical relucency, as you can see here. So I told the patient, just leave it alone. Leave it alone. We're not going to mess with that tooth. And we recommended, of course, endodontic treatment for tooth number 3. As you can see, that's the date. Over 2 years ago. 2 years, 7 months, 8 months. 2 years, 8 months ago. And this was immediately after we did the root canal. 2 years, 8 months ago. As you can see, 4 canal systems, MB1, MB2, distal buccal and palatal. And again, look at tooth number 2. The dentist just found one canal there. The mesial canals and the distal buccal canals are not, I don't think they were ever found, instrumented, and of course obturated. So, but as you can see, it's fine. So again, I told the patient, leave it alone. But this was immediately after we did the root canal on tooth number 3. And as you can see, that's the date. So 2 years, 7, 8 months ago. And this was yesterday. So as you can see, tooth now, the dentist put a post in there and there's a crown on the tooth. And as you can see, tooth is in full function, perfect. Patient had no symptoms when I saw her yesterday. And here's the date. As you can see, that was yesterday. So 2 years, 7 months, let's call it 7 months. 2 years, 7 months post-op of tooth number 3. Tooth, as I said, is in full function. Patient has no symptoms whatsoever. But now take a look at tooth number 2. She's developed decay on the distal of the tooth. But the endo is still fine. There's no periapical relucency associated with the tooth. So I told the patient, just have your dentist clean out the decay and refill this tooth and leave it alone. Again, just leave it alone. But again, you can see 2 years, 7 months post-op of tooth number 3. Root canal, perfect. As you can see, no periapical relucencies whatsoever. Tooth was within normal limits to percussion palpation, probings 1 to 3 millimeters in full function. So here you go. 2 years, 7 months post-op of tooth number 3.